Jim, just like you, he had a bone-on-bone degenerative arthritis of his hip joint. You know, considering hip replacement, trying to avoid it, he was walking on a cane, limping. We did the stem cells. How long has it been now?
6 weeks today.
Yeah, 6 weeks today. First month, there was really, the sharp pain was gone, but you know, it was kind of still there.
Correct.
And then once, week, the day after we did a booster treatment, what happened?
Within 3 days, there was no pain whatsoever. Just now, I'm limping from the past recovery. But see, I've got a replacement knee and a replacement hip, and I do not want to go through that again. And this has been, I got a shot in the other knee and a shot in my hips, and it's been absolutely a miracle. And so I'm here just for a second booster.
Yeah,
just
so
to be
we
sure,
just,
you know.
so when you asked, well, what percent of people, you know, respond to the stem cells for the hip? Well, I think 80% respond well. The ones that are stuck, we do what's called a booster treatment with the more high-powered laser and equipment. And just like Jim here, he has the clinical light stim panel, and then we do a booster with the high-powered laser, and that kind of stimulates the cells to regenerate the hip faster if you're kind of stuck. And that's why we do a follow-up at month 1, 3, 6, 12 to make sure you're progressing. And that's what happened to Jim. He wasn't really making any progress. And then we added the booster laser treatment, and then voila, pain is, it was what?
It was literally within hours.
Yeah.
But definitely after 3 days,
Uh-huh.
it was a miracle, you know, I mean, I'm telling you. So have you been considering it yourself?
Yeah, well, yeah. I mean,
Good.
just now. Yeah.
You owe it to yourself. Do it. I'm telling you.
Are you still using your cane
No,
anymore?
not at all.
Wow.
No.
Yeah, because I was concerned.
I hobbled in here a month
Yeah.
or 2 weeks ago with it.
And
right?
before
Yeah.
we did your laser guided stem cell treatment for your hip, what was the pain on the scale of 1 to 10?
It was
on a bad day?
It was like giving birth. It was
Yeah.
off the chart.
Uh-huh.
I didn't even want to step out of bed. It was so sore.
And what was it after 1 month and we
After
did the
1
booster
month,
treatment?
I was kind of disappointed, in all honesty. Like, and I knew it was some progress. I would say on a scale of 1 to 10, the pain was still maybe a 7 or a 6, and now it's like 0 to 1 if it's anything at all. It's just more like I have a little limp is all left, you know, which I'm working on. But there's no pain when I rotate my hip at all. You know, so do you have pain yourself right now?
Yeah.
Just standing there? For
Same
example?
thing, it's bone on bone,
after
years
I
of
stand
running.
a long
Yeah.
time.
Yeah.
Yeah. Yeah, so alive, he just happened to be here. Unless he lays here and, you know, tells
Yeah.
stories all day, but
Of course, you wouldn't tell me if somebody wasn't happy.
exactly, yeah.
It wasn't a setup.
Well, he wasn't happy.
No, I'm sure.
Because
Yeah, that's a
one,
great story.
1 month, I
was
mean,
di-
he was
I was-
still hobbling around. His pain was, the sharp pain, we took the edge off of
Yeah,
it.
right. Exactly.
But then we said, okay, let's see if we can make some adjustments. We did the high power booster laser treatment to get the cells, you know, woken up and further regeneration.
Yes.
And so it's not like we don't leave anyone behind.
Right.
We pull out all the stops to make sure it works. Okay.
Okay.
Yeah.
All right. So let's rebuild your hip too. All right.
All right.
All right.
Good
Thank
luck.
you. Thanks,
All
Joe.
right. My pleasure. to meet
Good
you.
luck.
Yeah. And then we'll do after today's booster. You know, we'll do a follow up in a couple months to
Yes.
make sure you're doing good. All right.
Thanks, doctor.
All right.
All right.
Great.